Good afternoon and welcome once again to our COVID-19 public health briefing with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government, and today we have several guests joining us for this session. Now, we only have about 40 minutes until about 1:20 this afternoon, where we do have a hard stop, and we're asking everyone to try and limit remarks as much as possible so we have ample time for the Q&A portion of this presentation for reporters. Now, with us today is, as usual, our County Executive, Sean O'Donnell from the Department of Health and Human Services, Council Member Craig Rice, MCPS Interim Superintendent, Dr. Munifa McKnight. I believe she will be joining us shortly. MCPD Chief Marcus Jones, and Dr. Raymond Crowell, who is the Director of the Department of Health and Human Services. And with that, I toss to you very quickly, Mr. County Executive. Good afternoon.
Good afternoon, everybody, and thank you for joining us for the weekly press briefing. As you can see, we have some guests with us today. Joining us to discuss the Reimagining School Safety and Student Wellbeing Committee report will be Craig Rice, Dr. Munifa McKnight, Marcus Jones, and I think Raymond Crowell. So we're looking forward to that discussion. Now that we're a few months into the school year, I thought it would be helpful to provide an update on where we are, but also on where we're going with this. Before we do that, I want to update you on COVID. And I think, as everybody knows, we continue to have very high vaccination rates. Our rates continue to be high, and I want to thank all the residents for their efforts and focus on getting vaccinated. As you can see from this chart, 84% of our residents have received at least one dose, and 86% of our total populations have received both doses. Our test positivity rate is the lowest in the state. It's dropped to 1.85, and our case rate is 9.44, which is second in the state today to Howard County, and theirs is 9.34. Two of us seem to jockey back and forth on this number. As you can see from the map, we're one of the two jurisdictions in the state that are yellow. Again, it's a testament to our high vaccination rates and the other measures we've taken. We continue to see our case rate go down. During last week's briefing, I reported our case rate was 10.85 per 100,000. So you can see this is a drop over that number. And our cases that got reported today, we had 112 cases yesterday, 5 hospitalizations, and 1 death. And so as you can see, deaths continue to occur, but they are certainly occurring at a lower rate than at the height of the pandemic. On employee vaccinations, yesterday I received reports from the key departments on public safety about the range of consequences and outcomes from the proposed mandates. As I said before, this information is going to provide us a better understanding of what our risks are. We're reviewing the information the departments are providing. We're also looking into where we are in terms of compliance, and this will all be presented to the council so they can get the same information that we have. I think it's critically important to understand where our vulnerabilities might be. I'll say this again, I continue to think everybody should get vaccinated. Unfortunately, running a county government is a little different than running an airline or running a restaurant, where delays in customer service have one consequence. We continue to be concerned about what else could happen, but we need to be able to assess fully what the departments are telling us. I'm now going to turn it over to Sean O'Donnell and Dr. Stoddard for additional updates, and then we're going to return to discuss the Reimagining School and Safety and Student Wellbeing Committee report.
Thank you very much, County Executive. You've covered all the very important things about the current rates of disease transmission. Just want to emphasize, I know a lot of our residents are interested in the mask mandates and when that could potentially change. That needs to go to a moderate transmission level as defined by the CDC, which would be an average of 49 new cases per day or less over the next 7 days, over a 7-day period. So we're currently at a rate of 66. So we still need that to come down a little bit further before that would change. We're also continuing within public health to increase our capacities across the county. We have moved this week into the Silver Spring Civic Building on certain days, offering vaccinations there. And we've moved into the East County Recreation Center, offering vaccinations there 7 days a week. This is in addition to our site at the Montgomery College in Germantown. We'll continue to look at expanding both the capacities as well as, once we move into the pediatric range, also expanding our hours even further to make it more accommodating for parents and students to get to our vaccination sites. We continue to work with our MCPS partners and our private school partners on strategies to ensure that we get vaccine out as quickly as possible when that becomes available. And we are still currently looking at the first or second week of November, potentially as the time periods. Of course, that relies on decisions made by the FDA and the CDC. Those are the only updates we have for you all today.
Thank you so much, Sean. It is back to you, Mr. County Executive now.
All right, so we're going to pivot to the discussion of the Reimagining School Safety and Student Wellbeing report. On May 12th of this year, we announced that we created this committee. The committee was made up of 32 stakeholders, including students, representatives of the Department of Health and Human Services, the Montgomery County Department of Police, Montgomery County Public Schools, and staff members from the offices of the County Executive and County Council. In order to more effectively address the responsibilities of the steering committee, they formed 3 subcommittees in June. One was the Mental Health Committee, the Restorative Justice Committee, and then one focused on the Memorandum of Understanding that was signed October 17th, 2017, originally between the Montgomery County Public Schools, Montgomery County Police Department, Montgomery County Sheriff's Office, Rockville City Police, Gaithersburg City Police, Tacoma Park Police, and the Montgomery County State's Attorney's Office. Today, we want to provide you with an update on the report and the initial recommendations, timelines, and actions that are in there. And I've asked Marcus Jones, MCPS Superintendent, Dr. McKnight, Dr. Raymond Crowell, and Councilmember Rice to join us today for this briefing. And I want to thank all of you for joining in this presentation. I also want to thank Councilmember Rice and his colleagues for their partnership. We've come a long way and there's still a lot of work to do, but we're doing this collaboratively. Back in August, I announced that at the start of this school year would be the end of the SRO program, as we've noted in the county, and we're introducing the Community Engagement Officers, or CEO program. This was just one aspect of our comprehensive and holistic approach to ensuring that our children are safe in schools. As a former teacher, I long felt that there was a far greater need for social and emotional support for our students. Our young people often struggle with the circumstances that they experience that can lead to depression, that can lead to just generally being unsettled about their place in the world. And this effort is about putting the welfare of our children first so that our schools can provide a safe place for them to learn and grow. I think the 3 big takeaways from this are that, now you'll see this in the slide, but I want to emphasize this. One is to look at the root causes of behavior from mental health perspective rather than versus a delinquency lens. And with funding for mental health supports rather than police response as a solution referred to as restorative justice, then the work that subcommittee did. And it speaks to a shift in school culture that can be addressed through restorative justice training. We create and enhance systems of support to respond to student mental health crises in schools and assess if there are sufficient mental health professionals available to students for proactive engagement. I gotta say, as somebody who taught school, spent 12 years on the county council, this is the most comprehensive review of how we deal with mental health issues in our public schools that I can remember ever taking. It gets into a level of detail and into the complexity of students' lives in a way we haven't done before. I think in the past, we've looked for magic bullets. I think we realized that there is no single magic bullet. This really relies on our ability to provide the kind of services and to develop a deep understanding of the issues that children confront and how those responses to those issues, play out in our community. We want everybody to be safe and healthy, and we want everybody to be able to access the supports they need. This continues to be a collaborative effort and partnership, and I'm proud of where we are and where we're heading. And at this point, I'm going to turn it over to Dr. McKnight.
I believe Councilmember Craig Rice was coming first, and for participants in the chat, you will find a copy of the Reimagining School Safety and Student Wellbeing Report. Councilmember.
Well, thank you very much, Lorna, and thank you very much, County Executive Elrich. Let me just again thank you for your partnership. It is really important for us to make sure that we're doing this together, both the executive and legislative branch working hand in hand with the community. And that community includes our school system, our police department, all coming together to try and make some decisions about how we're going to move forward to ensure the safety and well-being of our students. One of the interesting things is that we've had the RSSW report released at the same time as we've had the Student Wellbeing Action Group report. Many of those recommendations are identical, and that's exciting. It's exciting because it sees that folks on different sides of the aisle, when it comes to what they're ending up saying about what they want to see happen in our community, are really very closely aligned. And that's very promising. It's very promising in terms of what we'd like to see continue to happen and move forward when it comes to reimagining our police force, but it also is imperative that we keep our kids safe. Just yesterday at Seneca Valley High School, in the close proximity, we had a shooting. And in that shooting, fortunately, no one was injured, no one was hit, but it was very scary to Seneca Valley High School students. I actually was there on site afterwards that afternoon with Principal Cohen and had a chance to talk to him and found out that there were 2 officers that were actually in very close proximity to Seneca Valley High School who actually responded immediately to the gunshots. I want to make sure that our community understands that while we're reimagining what happens with how our new role of these CEOs will play, our students will still be safe. Our community will still be safe. Does that mean that crime won't happen? No. But it does mean that we have prepared ourselves and aligned ourselves in such a way that we can easily respond to incidents that happen and ensure that we try and mitigate any kind of crimes that happen and mitigate the risk that we have to our students. That is our charge. And I'm very happy to work with Montgomery County Public Schools in making sure that that happens. As we talk to many of our principals who are the leaders of small cities when it comes to their individual jurisdictions, it is imperative that these principals have a belief in a program that's going to keep our kids and the staff and administrators safe. And I think that today represents a great time where we've seen some terrific recommendations that the council stands ready to work with the county executive in bringing to full fruition, along with MCPS and MCPD, to make that happen. And so we stand ready, Mr. County Executive, as a county council to work with you, whether it's budgetary or policy, to ensure that we can enact these recommendations of both RSSW and SWAG so that we can move forward with a new iteration of public safety that still keeps safety as well as well-being of our greater community in mind. Thank you.
Thank you, Councilmember Rice. And now Dr. McKnight, it is your turn. Go ahead. Thank you for waiting.
Thank you so much. I appreciate you all, County Executive Elrich, for the opportunity to participate in this press briefing today. Councilman Rice, always being that support of the school system and thinking about what it is that we need to ensure that our students are learning and are able to do so in a safe environment. And I'll just start by saying, I am greatly appreciative that we were able to come together as a variety of different agencies to say, what is it that we need to do to accomplish three things? And I'll say the following that we focused on when this reimagining school safety and student well-being steering committee was developed was to, one, focus on how do we continue to keep our students safe, as we know that is a priority, safe mentally, socially, emotionally, and all of that. Third, how do we make sure we continue to focus on building those environments in our schools for all of our students? And how do our programs enforce that? So that was the second part that we looked at. And then the third focus of the steering committee was also to really think about how do we bring together a number of different agencies, all wrapping around the school system and thinking about how do we coordinate our work to create these desired spaces, spaces where students can learn, thrive, be safe, physically, socially, and emotionally. And with that said, the committee came together and outlined some really important recommendations for the work that we're doing in MCPS to keep our students safe and support their social emotional well-being. And I can't not acknowledge the work of the students on the Student Wellbeing Action Group. They have absolutely been incredible. Their feedback has been incredible. And I always say, as a good teacher, as a good educator, all we have to do is listen to our students. And they tell us all the things that we're trying to figure out and plan for their well-being. So they actually released a final report yesterday. And as Councilman Rice said, a number of their recommendations aligned exactly with the recommendations from the Reimagining School Safety and Student Wellbeing Steering Committee. So with that, we celebrate because that means we were not far off from one another in terms of what our values are and what we want to build moving forward. In particular, both groups absolutely made recommendations about ways in which MCPS can continue to partner with the Department of Health and Human Services and other stakeholders to best support our students. Good news there. We've been partnering with the Department of Health and Human Services since we've started to manage all of the COVID-19 needs. This is just us extending that collaboration in another way to really build these innovative ways that we approach supporting our students as a result of COVID-19 to make us better than ever. And so we're excited about that. And we actually just received some news at the end of September that our plan from the state was approved for the federal relief funds. And so now we're able to hire those 50 social workers that we initially put into our plan that we are able to put into our school system and provide in our schools in the very near future for our students. So I'm happy to share that. That's hot news off the press that we're excited about. And of course, we will be collaborating or continue our collaboration with DHHS to make sure we meet that need. I also want to talk about the strong embrace of our use of restorative practices in our schools. And I will always clarify this every opportunity I get. Restorative practices really is a model that we continue to put in place to bring resolution to any conflict that exists within our schools. It does not mean that we do not have discipline practices that we put in place. We do. That is necessary. That's a part of what we do, but we also know that restoring the environment is really important. So we provided professional development to hundreds of our staff members this summer around implementing those restorative practices in our schools. And we'll be using those recommendations in the reports moving forward to figure out a way to further expand that to all of our 209 schools. We know that conflict will arise, but we also know that our students have great capacity to figure out ways to discuss, lead, and work through some of those problems. And we want to build their capacity to do so, as well as our staff who will be working with them. A significant component of the Reimagining School Safety and Student Wellbeing Steering Committee was to provide a report that deals with the relationship between MCPS and the Montgomery County Police Department. I will say Montgomery County Police Department is a critical partner in the school system and working to keep our schools safe. So although we reimagined what this whole process would look like, I want to emphasize we will continue to have a relationship with our police department. They are a part of our community. They actually were very helpful as we opened up the school year. Many of our parents shared information about traffic lockups and as they were driving their students to and from school. And so our police department came and helped us out there and have also been able to help us just think proactively about how we can or how we may be able to utilize them based on situations that may arise. So I just want to say that because I think it's really important to highlight that as we do further define exactly what that role looks like in supporting the school system more deeply through evaluation of the MOU. And then the final remark I'll make is that the RSSSW interim report began with the process of reviewing the MOU. And again, the county executive spoke to that, and I really appreciate the work that was done there with MCPS and MCPD and the state's attorney's office, and all of the other municipal police departments throughout the county. We have a number of different agencies that help work with our schools and our school system, so we appreciate their collaboration. I'm also very excited and encouraged about the fact that we're going to be incorporating the Department of Health and Human Services into these conversations so that we can add them into that MOU discussion and think about how we can comprehensively build out these programs to best support our schools. So I say that's the other lever that we'll pull into our MOU to further define exactly what our work is together, and most importantly, talk about how we implement that and measure it so that we can see the success of the work that's been developed by many. So thank you so much for the opportunity to share comments on behalf of the school system. And I also have our Chief of Staff, Jimmy DeAndrea, here with us today, who has been an active member on the RSSSW group. So he's joining here with me as well today. Thank you.
Thank you, Dr. McKnight. I believe it is your turn, Chief Jones. Good afternoon.
And good afternoon to everyone. Thank you, Lorna. And thank you to the county executive and Dr. McKnight and Council Member Rice for their remarks, and Dr. Kroll and all others who have been partners for us to establish this new program, the Community Engagement Officer Program. We have dedicated officers who are responsible for over 200 schools in our county, the largest school system in the state. And with that being said, we have developed a cluster model in order to be able to respond to schools in a quick manner and to be there on patrol. And those officers who are community engagement officers are solely responsible for responding to schools and assisting schools as needed. As Dr. McKnight has noted, the partnership has worked really well with the memorandum of understanding that's been established, that we know on all sides what is the role of all of the parties involved in order to make sure that we are keeping our schools safe. Our officers have been engaged as well as the school staff to have those partnerships and to address any of the safety issues that are noted. They are making calls to our emergency communications center in a timely manner for us to be able to handle any such situation that involves, and to include things such as traffic control. That has been probably one of the most challenging things that we've done due to the fact that we know that many parents are now driving their students to school. But I also want to just recognize our other law enforcement partners, Sheriff Darren Popkin in the Montgomery County Sheriff's Office, as well as the City of Gaithersburg Police Department with Chief Stroka, and the City of Rockville's Police Department, as well Chief Vic Brito, for providing additional personnel to also assist us, as well as Tacoma Park with Chief Tony Duvall, in order to be able to make sure that we are responding to our schools in a timely manner and providing the kind of safety that's needed to make sure that our students are safe. So we have been engaged. I think it's a clear memorandum of understanding for us to have this clear understanding of what are the roles of police officers as we respond to our schools on a needed basis. And that memorandum of understanding has really clearly defined the new role of police officers and public safety in Montgomery County. So thank you.
Oh, I couldn't find my mouse here. Okay, thank you, Chief Jones. Last but not least, it is you, Director Raymond Crowell. Good afternoon.
Good afternoon, everyone. Pleasure to be here, and thank you for taking the time out to learn a little bit more about it and hear a little bit more about the work that has been going on over the course of the last several months with various committees. And thanks to County Executive Elridge and to Councilmember Rice for all the support in getting to this point. The role of HHS in this has been broad. It has always been broad. We've done a lot of work over the years, both in collaboration with Montgomery County Police Department, but also with Montgomery County Public Schools, and expect that will continue. Our group and the work group in this reimagining school safety process was focused on the mental health work, and recognizing, as Councilmember County Executive Elwood said, that we are examining the root causes of behavior from a mental health versus delinquency lens. And that for us means that we are looking at understanding what is driving the issues. And it's really first several things. One is addressing the behavior that is causing an immediate problem and restoring some safety in the school and with the student. And then understanding those drivers, whether it's family drama or family issues or COVID issues or trauma or some other social conflict, so that we can understand how best to resolve those issues in a way that is supportive of the family and the child in the school. And then third, to craft longer term responses to address the challenges that allow schools and students to stay safely on the task of education. The task for this group also included sort of creating systems of support to respond to student mental health crises in school. We know that in any given year pre-COVID, we had over on average 2,000 students that showed up at the crisis center and that we responded to who had some form of behavioral health challenge. That number under COVID last year dropped obviously because the schools were closed, but it is coming back and it's coming back strong because we know people have had, in addition to anything else that's going on with them, that they have had a year and almost 2 years of dealing with this pandemic and suffering losses and stresses associated with that, and now having to get readjusted and reacclimated to being in an environment with each other. And that in and of itself will create some stresses and some challenges. So the group came back with a number of recommendations around this. And one was obviously, and no surprise, to increase the training for all MCPS staff and indeed all the staff who are encountering students on de-escalation skills in an effort to reduce the number of frequency of crises and incidents in the school. So we start with some promotion and some prevention and some social emotional learning activities and strengthen that piece of the work. The second thing is to work to create a comprehensive and really integrated crisis intervention process so that includes HHS, partners and community support, so the staff and students and across the whole system will understand how we collectively respond to a crisis in the schools, and whether that is crisis center that's responding or our positive youth development team is doing something, or school well-being teams that are taking the lead on responding, that we have an understanding of how we're going to do this in a more integrated fashion. And then the third recommendation for them was that we work from the team was that we work to promote and support school well-being team leaders. School well-being teams were instrumental in during this pandemic in staying connected to students and making sure that students who were learning virtually were engaged and connected to us, and that they could get the resources that they need. That doesn't stop now. In fact, it's an opportunity for us to strengthen that work and build on what we learned during the pandemic. And then finally, to increase capacity and knowledge of our school counseling staff and the staff that are available to support the students' social emotional needs. And a piece of that you've already heard that Dr. McKnight is on path to recruit social workers to come in and be part of the school staff. They will join with and take lead and complement the array of other behavioral health staff and professionals and peers and paraprofessionals who support the work of promoting social emotional learning and stability. And then I think the last piece was obviously to bring on more mental health navigators and behavioral health resource specialists. And part of that is already wired into our work around expanding mobile crisis and outreach teams, but also our peer recovery specialists and our a variety of navigators to make sure that we can quickly link students and families with the mental health providers and supports that they need beyond the moment of a crisis. So our next phase of this work is really to continue to deepen the relationship and the partnership between public schools and law enforcement and HHS via a behavioral restorative model that really makes it clear about how we're going to respond to situations and what the expectations are of students and of staff and who's going to respond when. The other piece is obviously to make recommendations to the county executive and to the school board for any additional resources for behavioral health support and support for students and staff in the schools. And then of course, working to implement the recommendations from both committees, including those of our students, which is Dr. McKnight pointed out, a vital source of information and knowledge about how to get things done. That work is evolving and will evolve over the next year. We are coming out of a long period of time where behavioral health was not a resource that was really thought about the way we're thinking about it under this administration and in the last couple of years. It represents for me a watershed moment of recognizing the role that behavioral health plays in promoting the health and well-being of all students. In the meantime, however, the work has not stopped. We expect that we're going to continue to see students that will show up in need of behavioral health services. And we know that there are students who are struggling with returns and the ongoing trauma of COVID. And we're using our crisis services, our public youth, positive youth development programs, our school health wellness centers, the staff at colleagues in MCPS to address urgent issues to restore and help maintain student safety, and to working with MCPS to create, for now, real-time responses to help families and schools deal with issues and support while protecting their safety. Dr. Mean, I think you heard reference to the shooting in Seneca Valley from Councilmember Rice, and there was an earlier incident up at Plumgar a few months ago. We have teams that are now meeting regularly to work through those situations to make sure that the families are safe, that the students are safe, and to try to make sure we de-escalate those situations in real time and get people the help that they need. So that work will continue. It will involve all the parties you have on this call with you today, and the family members and the parents and the students to try to make sure that we collectively promote the safety of our students and give them every opportunity to get back into a normal educational opportunity from day to day. So with that, I'll stop and turn it back over to you, Lorna.
All right, thank you, Director Kroll. We have about 9 minutes left for this event. Reporters, you are going to hate me, but I'm going to set some rules so that we can get to all of you today. Let's be fair. One question to get started, and then if we have extra time, of course, you can do your follow-up. Sorry, guys. We do have that cut off at 1:20. Let's go, Kate Ryan. You're number one. Sorry, just one question.
Thank you, and I'll make it quick, and I'll jump right to one of your special guests, Dr. McKnight. Dr. McKnight, you mentioned two things, 50 social workers, thanks to this, I'm assuming that's the federal money coming in. How soon could they be deployed in schools? And a separate question, when I spoke to someone about the incident at Sherwood, and the principals came together and said they're going to have ongoing dialogues and they'll make use of the equity initiative unit. The person I spoke to, an activist in the community, said they do great work. What she'd like to see is them deployed in more schools at the cluster level rather than, and correct me if I'm wrong, kind of parachute in after an incident. Are there plans to expand that? And I'll let you answer the questions. Thank you.
Yeah, thank you, Kate. I appreciate that question. So we always take the feedback from our community members in terms of how they believe the services are actually being designed to reach the students in a meaningful way. So our equity initiatives unit have always existed from the central level, but we also have them work with schools intentionally on specific types of projects. Now, of course, we have a school system of 160,000 students at this point, and we have about 11 people in our equity unit. So we do have to be very strategic in terms of how we utilize them. I will say, as we bring our students back into school this year, we're looking and learning lessons about how we are utilizing our central office staff to make sure that they are available to our schools in a way that is necessary. So I do take that that recommendation from the community member that shared that with you under advisement. Your first question was around
the 50 social workers.
Yes, thank you. The 50 social workers. Yes, so we are hoping to be able to employ them soon. Earlier this summer, when Dr. Cole and I had a conversation about this, we actually said we would need to work in tandem to accomplish this this goal with getting our social workers into our schools. And so, and we'll be working with the Department of Health and Human Services and trying to contract out those social workers so that we can get them into our schools as quickly as possible. So that is absolutely our priority and a very front-facing priority that's at the top of our list.
Ballpark timeline, end of year, before the end of the year?
Oh, we are definitely hoping before the end of the year for sure. What would be great is if we're able to hire all of them to be able to support all of our schools by the beginning of second semester. That would absolutely be aspirational. But of course, we know that the labor market is what it is, and so we'll work through those challenges. But but that's what we aspire to do and to give ourselves some time.
Thank you so much.
Thank you, Kate. Next is Brian Grenbaum, MarylandReporter.com. Good afternoon, Brian.
Good afternoon. A question for the county executive. What would you say to those who may disagree with the decision to remove police from the schools? You know, some people might say, you know, it's great you have this mental health infrastructure, but once an incident happens, you know, it may be too late for, you know, remediary action to take place. What would you say to that?
I'd say a couple of things. One, there's been evidence and incidents where police were there and things still happen. So this is not a panacea against, you know, bad things happening. More importantly, I think that, you know, contributing to a climate where students, you know, often feel unsafe and threatened. And, you know, frankly, you know, there's a lot of discomfort in the student body about police. I'm not sure that contributes to a better climate in the schools, and if it helps students manage some of their problems better. And frankly, we need the resources going to things that I think are going to be more responsive to the needs that students have. We continue to deal with the after effects and symptoms. We've not been upfront in trying to help students not wind up in the places that they've been winding up. And I think this is going to be helpful. The police are still close by. The state doesn't actually require officers to be in schools. I had this conversation with the state committee very directly, and they had no requirement that they be in schools. So what we're doing is in keeping. We've got dedicated officers. What their biggest concern was not having to call the police department and worry about whether somebody is out on a traffic stop or investigating something else. This gives people who are dedicated and able to respond to the schools. So we maintain that commitment, and we're going to make sure that it works.
Thank you.
Thank you, Mr. County Executive Steve Bunnell. Bethesda Beat, your one question, please.
Good afternoon, everyone. You know, it's interesting. I was listening to the county council meeting yesterday. One of the things that caught my ear, kind of questioning about all this, is, you know, even knowing that these 50 social workers are coming on board, I think it was Dr. Stoddard that said there's been a challenge with school health workers leaving just because of the stress of the pandemic. Stoddard, you can address that, or anyone else who wants to weigh in. What is the county doing to kind of actively recruit people given that challenge moving forward?
I'll let Dr. Kroll principally answer this. I will say that, you know, so there are two different contract agencies that have been engaged to address school health staffing, both on the front end, because we knew we were going to go into the year down some, and then also on the back end as we've looked to expand the testing capabilities that are available through the school system. And so I'll let Dr. Kroll talk to those in a little more detail, but there are multiple efforts underway to address the ongoing need.
Thank you, Dr. Stoddard. So related to school health staff, we have both nurses and we have health techs that operate in the school health system right now. And we have combined in the neighborhood of 300 of those folks, who are 350 or so of those staff that are active every day in the school system. We are down probably of that. We have a whole complement. We're down about 40 positions and are actively recruiting. We also had, in the last 2 years, thanks to the county executive and the county council, additional nursing staff added to the complement. So we're in the process of growing that staff. We have had a number of folks, because we've had some staff that are aging out of the system, who are retiring and moving on, who stayed with us through this pandemic longer than they might have otherwise, and have now decided that it was time for them to retire. So we had a few people that left at the start of the school year, but we offset that by actively recruiting and by adding, I think, 40 additional nursing contract nursing staff to the complement of MCPS that is working in MCPS, just so we could strengthen that. I would not argue that we have all of the resources that we need to do nursing across and health across the county, but we have a stronger team. And to help us with the testing pieces that Dr. Stoddard mentioned, we're also adding additional staff that will come in to help us with testing. And when the moment comes, to shift some of that resource to vaccination for our younger population as well.
Okay, so I'm going to defer the last question very quickly. We have 1 minute to Kevin Lewis, ABC 7, because I know you need audio and video. Please make it in 30 seconds if you can.
Thank you so much. County Executive Elrich, are you prepared to veto a vaccine mandate should the county council approve that next Tuesday following the public hearing. And just as a second question, 7% saying not vaccinated, 14% still not reporting, according to the county's portal dashboard from this morning. Is there an issue with getting those 14% to report? If so, why? And are those 7%, is it fair to assume they're saying not vaccinated and don't plan to change our minds?
I think the latter is probably a fair interpretation of it at this point. Obviously, they've had plenty of time to get vaccinated. The first part of the question, I'm not prepared to veto anything, because what we're hoping is we have a discussion about some of what may be problems. I have not seen the report from the departments yet. I know that, there are council members who all share the same concerns I do, that at the end of the day, we have to deliver critical services, and we need to be able to tailor what we do to match our ability to deliver the services we're supposed to deliver. So hopefully we all can come to some agreement that we can move forward in a way that doesn't jeopardize my ability to get an ambulance to arrive on time. I've never, talked about this broadly and said we shouldn't have a mandate for our employees. From the beginning, I've focused on the 3 public safety departments where their inability to provide services could have serious consequences for our population. We need to figure this out. And I honestly don't have the answer to that yet.
Thank you, Mr. County Executive. Our apologies to everybody. We do have a hard stop right now. Reporters pending questions, do address them at PIO. Thank you for joining us today. Have a great afternoon.
Thank you all.
Thank you.